My log is in. Okay, yeah, Jersey. I'll log him in. I'm going to Jersey. I'll log him in, not just the national. Page. About Pierre,
The video question.
Mark address, everybody, I'll just what the question. What you talking about? Long time ago. Hmm? Black or white?
As if they announce my name, they go, they tell people say I'm a bad person. Don't forget, say the day when those people go meet me one on one, find out say I not be bad person, I be better person. That day, and you got some bad person.
Okay, check the first is nobody make class. I thank God, yeah, another recording. No one touches the radio now. So, also the family, this one. We are Jamaica. Okay, family. Okay, try to call one. Why? Everything kind. Okay.
Good evening, good evening. Can somebody say hi?
Good evening, doctor.
Good evening, ma'am.
Hi, doctor. Good evening.
Good evening.
Hi,
Good
doctor.
evening.
Good
Oh,
evening. How are you?
good evening, everyone. Good evening, good evening, good evening, good evening, good evening.
Good evening, doctor.
Hello, doctor.
Good evening, ma'am. Happy day, everyone.
It's a pleasure to hear your voice.
Same here, ma'am. Good evening, good evening, good evening. I'll just mute us and we'll quickly start. So we'll go back to our traditional NCLEX one today, so we can relax a little bit from our NGN already. Good evening, everyone. My name is Dr. Kemi Akinlaon. My number is 281-372-9148. I want to make 100% disclaimer. I don't have access to NCLEX question. I don't have any connectivity with Pearson. I don't have any relationship with NCSBN. If you peradventure see any part or whole of this in your exam, I have made a disclaimer. I don't have access to NCLEX question. If you screenshot, if you snap any of the questions, it's going to be permanent or personal to you. Once you are done with the exam, any of our will not be shared at any point in time. We are expected to spend close to like 3 minutes on a question. Some of them are worded a little bit more intense. So maybe 3 minutes on a question. If peradventure have changed the question and you have not finished that question, because everybody does not have the same method of attending to question in that 3 minutes, you don't have to send me a message. You don't have to call me. I'm the only one handling this. So you can imagine doing this, attending to calls, attending to all your concerns.
Oh,
So if
house.
peradventure I've changed it, you don't have to call me. By the time I start to
On your
break
way.
down the rationale, you will see the question again. And even after breaking down the rationale,
Another
we will still go back again, number 1 to 50, and you can have access to it. So let's make it well organized. 3 minutes on a question. If you get almost 35 out of the 50, I made it in 100. We'll just do the first 50 today. If you get 35 over 50, you're doing good. Your content is fine. You can pat yourself at the back. If you get more than 35, that's a qualitative one. That is the level we want you to be. If you get less than 35, you still have a long way to go. You still have to work on yourself to know what is required before you go for that exam. And that is that. So we're going to start now. Our 3 minutes start now. We're going to be starting. Let me change it to slide mode. Okay, so everybody can commence right now.
Bah, ben du quoi et bon, on which one I don't know to know you. What's the problem? Which facility are you going to UAP? I said, one, administer medication. B, assessing pain level. C, assisting with bathing. D, performing wound care. Or bathing. Go to call home. Go to call home. You can do it.
Joshua. 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 Tell me Papa told. But I'm going to say, Master, yeah.
I'm not going to be able.
Where's your Papa told? What are you doing?
You have legs.
Then where is it? When did you leave the house? Where is the door?
My closet. My closet.
In your closet. Make sure your door doesn't pee on anybody's clothes. I get it out from the closet. Put that in there. What is he doing in the closet? No, they're for the train.
Macam, cabo. Regular traditional question. Bega go this one. Bega do. Go question at face. Come you choose.
Well, it do be. Why should it be me?
Okay, give a question. I can now go. Yeah. I'm a new student. Mama go Jamia. Often because also a nurse needed, the nurse need to delegate to UAP. Which task the nurse should delegate? Administering medication, performing head-to-toe assessment, measuring and recording vital signs, creating a care plan. You know, from your look elementary to me. Kind of nature, that's not the stress out. Not in the board. Kind of nature AVM. Kind of.
Oh.
Don't allow anyone nightmare exam. Take the gun out. I'm going to do something. It's a even Guinness schedule. Can't get Spanish, you know. Dr. Rosina. Amen. Get on to. I'm an AVM. What can you make up? Not very can you AVM.
Why was he even on probation?
If that's in bed, the way my shoe out.
A patient in dialysis, it's not just in dialysis. Do you encourage him to continue, or do you to respect the current wishes and support him? Contact the family to persuade them for him to continue dialysis.
Persuade is not the right word.
Refer the client to psychiatric evaluation. So more choose irrespective of the current wishes.
I'm leaning towards that, but in your real life,
Even encouraging.
I'm not very convincing. Yeah, but I'm gonna go for God. Okay. Oh, I'm gonna go make out with you.
Yeah.
Well, when I tell the dog sit, it doesn't.
Wow.
Oh, how come you guys haven't set up a training with them?
It's not old enough.
How many years you been?
It's only like 10 or 12 weeks old. Heck.
Is he hungry?
I don't know.
Take him to go give you food.
Sometimes when I put food, she doesn't eat.
Go try. Veronica, also a client is scheduled for surgery and does not have a signed consent form. What is the best nurse action? Proceed with the surgery. Notify surgeon immediately. Have the client sign the correct form post-operatively after surgery. Have the client sign a waiver. None can put out already. Yeah, you mother and us. We are actually everybody challenge you. You have to think. What? He need water.
I thought it was a she.
Is it she or he? Give him water.
I put water in it and she started eating.
Right. Is it right?
Uh-huh.
I see. That's why it's hunger. Not yet.
I think I'm not like a wood seeker. Like I'm doing now.
A nurse noticed a colleague chatting vital signs that were not taken. What should the nurse do first? Comfort the colleague immediately. Ignore the behavior to avoid conflict. Report the incident to child nurse. Take the vital sign and update the chat. Question at the top. Emergency at the top. That's it. What did the nurse do first? If you report here, you need to take the vital sign and update the chat. I think I'll report him first.
Where are you going? Okay, man.
So, how are you gonna get it?
That's it. Not Carmex.
You can see the camera you can do. The dog is not here. You ask Jason.
She has it.
Can you stop? Stop this. Nobody to get this thing down. Can you stop? How did my powder disappear from this house? How did that happen? Let me see if there's anything to fix.
A client asks about their right to refuse treatment. What is the next response? Agiji agidi. Agaboni balama.
No, you asking me for money. Where you going to get it? Only I'm remaining on meeting. I can only give you the money.
Yo, $10.50.
Listen, come. I'm gonna look. I think you're gonna make up. I need to. Can you look at my? I'm going to bed it for you. Look at my actually see. Is it look at mine?
I'm looking for
You
my.
took the dog.
Yeah. She was saying you wanted to do anything with her.
Did you take out the one that he googled and put in your thing?
Yeah.
Why you don't go back to the lady for the weight loss lady? I won't even say anything. So let's think I'm controlling.
Because again with this.
No, I didn't say she gained weight. For her to continue her weight loss journey.
But she don't want to lose weight. That's her problem.
She doesn't want. You don't want to lose weight.
I didn't even gain anything.
No, but
You have to
I said
accept.
continue.
But I didn't lose either.
Yeah, but were you consistent?
Huh?
Were you consistent?
No.
Exactly. You have to be consistent. I think your weight loss thing is something overnight. No. You want to take a while before you to start seeing results, especially women. Okay, I'm looking. I don't know how I lost my card. That means now I have to go to the
Now I'm go get another to fit my skin because I don't think this thing fits my skin.
And ice cream.
Who's getting ice cream? No, no, no. That's what I'm asking. That's saying. So my actually is okay. Okay.
They finished the box and now you can get them. They're not even
Which
the ones you
box?
asked for.
Who finished the box?
The Oreo ones. Now you can get them.
Where were you when they were getting ice cream? No, I got a bunch of people that eat and do not care about anybody else in the house. You already know that. You see food, you get it. If you don't want to eat it, then you get it. You wrap it around, hide it on a deep freeze until you're ready to eat it. I keep telling you the same thing over and over again. Whichever says it, you go eat it. It doesn't care who it is. I also go exercise. All the clothes, even the one of them fits in. This is bikini. This is my cousin. This is my out there. I've been used as of 2 weeks ago.
Only does he mean? If I can the gym.
Yesterday, I'm sure they cancelled it. It's not because now that I late, I might just cancel my website. Why did she go with Justin yesterday that she went with could have gone there. There's electrical here. You can also use them. Joshua, you know your daddy is recording his exam.
Can you go?
Anything you're doing in this room is being recorded.
The thing is recorded.
Thank you.
That's how I do mine. That's how I do.
still not here today. What the hell? Shit. This lesson I asked her if he's done, because I don't know what's going on. I asked lesson if the phone is activated already.
Is she even here?
Did you call her on the phone?
Is she not here?
Ask this. Call her. Oh, my phone is turned off.
Call me, sis. Call me.
What happened? Is it on? Can you call him? Alright. Call him and let me know if it's on. Yes. Yeah, I know, but did he go to the jail? Did they let him in? Did you ask him or you just answering me because of my answer? Did you ask him that specific question? I know, but I just turned it on right now because I was struggling with the phone. Do you understand what I'm saying? I just turned it on right now when you opened the garage. That's what I was asking. Because I was struggling to turn it on, but it wouldn't let me. Do you understand what I'm saying, Desi? Ask me. You can't. Why? Yeah, can you call and ask him if they let him in? That's all. Alright, then you can text me and say that he's in. That's it. Alright, I have to come and look at my makeup and make sure it's white. Bye. Try to clean it this. Baby. Should we take that along this for no cutting?
Like we are 5:30 or 4:30. 5:30 time. Wow. Immutable. No. No. I don't know. Yeah. No, you can't. No, it's 3 o'clock. And then 2 more. Yeah, I'm going to do it. I'm going to do it. Daniel? No? Qu'est-ce que tu te dire? Qui you want? Il t'a jamais compris qu'il est hors. C'est là qu'il est arrivé. Oui, il y a encore, il y a encore. Non, moi, je me chante en moi, dans 3 mois. C'est ce que je te dis, quoi. Que tu as mis crédit, énergie, et il y a une time. Ebe na akwado n'oge na nne ka dazan nne-eme ya rime ihe wọchị fụna ihe ọ na nne nne jesọs kọsọ ọ na-egbu oge ọchị bịa be leta ka gbasara ngwa no problem.
Let's take State Route 91 East Compton and I-105 East. In 4.
Hello, hello, hello. Good evening, good evening. Can somebody say hi?
Hi, doctor.
Hi,
Good
doctor.
evening.
Hello, hello.
Hi, doctor.
Hi,
Hi.
Cammy.
Hey, doctor. Good evening.
Welcome, sorry.
Yeah, good
Good
evening.
evening.
Good
Right.
evening.
Hi,
Good
doctor.
evening. Right now, I'll just mute everyone.
Good evening, Dr. Kemi.
Yeah, good evening, sir. Pick your pen and paper. We should start now. If you need to ask question, just leave it to until we finish. And if I need to ask question, you raise your hand. I'll call you, then you'll be able to answer. The nurse is preparing to discharge a client who newly diagnosed, who have a new diagnosis of diabetes. How should a nurse ensure the client understand their teaching instruction? So most teaching, even if you don't know what to speak, most of the teaching, you always ask the client to repeat the instruction to the nurse. That is always the template for most of our teaching. So if we don't write it this way, in the exam, they can call it a teach back mechanism. They can call it teach back. Tell the patient to teach you back what you have expressed to the patient most often. And if they connect it to most of our ethical questions, some of these ethical questions, some people don't have the same language like the nurse, and the nurse has to make a demonstration. So the only way I can know whether the patient understood what I've expressed is for that patient to repeat what I've demonstrated. So in any way, that's the only best way to know whether someone has understood what you have expressed. So not only in this way, we only lay down our content in form of question, the way they are asking. So it was not going to be word for word, but you're going to see something of that same principle. A client refuses a blood transfusion due to religious belief. What should the nurse do? So very high yield in the exam, questions related to blood transfusion. You always connect it to Jehovah Witness. Respect the client's wishes and notify the HCP immediately. She said, I don't want it. So the best thing is, I'm not gonna give you. Let the doctor take it up from there. That should be the best. I have a mantra here, and I always want to be reading the mantra. And each time, even if I forget to read the mantra, please always read the mantra. When you feel like quitting, remember why you started. There's a reason why you went to a nursing school, and the aim is wanting to be a nurse. So anytime you feel like this is too much for me to do, have it in mind that some people are medical doctors, they are also studying. Some people are pharmacists, they are also studying. Some people are psychologists, they are also studying. Anywhere you want to run to, you are also going to study over there. If you say you are running away from nursing, you still study there. So you don't want to quit. Just remember why you started. And the last time I checked, nurses are taking a six-figure salary. They are having a six-figure salary as an LPN or a PA or an RN. And before somebody can say, I want to get a salary of six-figure, it is not for every Tom, Dick, and Harry. It is not for every Tom, Dick, and Harry. You must be exceptional. You must be exceptional in what you do for you to be a six-figure earner in United States. It is not for everybody. So if you have it in mind, the output or the outcome, what you want to achieve in the long run, it will make you to grind further. It will make you never to give up. Nobody's gonna die. You will still achieve it. So that's it. Go further. A nurse is caring for a client with a DNR holder. The client family insists on CPR. What is the nurse best action? So all these are popular, most popular fundamental content that it hacks. So what is the best? We are going to explain to the family what a DNR holder means, and you are going to adhere to the client's wish. That's always at every point in time. Even when the family say no, yes, so they say, can you resuscitate our mom? The person say, do not resuscitate. That is the meaning for DNR. This question insists on CPR. So that is the only reason you are going to go by the patient. But if peradventure, I change this question to patient is a DNR patient, and family say, can you give oxygen? Who is going to answer that? Patient has a DNR holder, and the family say, my mom needs some oxygen. Can we give that oxygen to the DNR patient? Let's do a little bit of, let's massage our brain cells a little bit. Okay, Miss Adela Kuman. You can go ahead, ma'am. Miss Adela Kuman. Okay, somebody here. Miss Tini, you can unmute yourself. You can unmute.
Well, the nurse is going to give oxygen. The only thing she won't do is do a CPR.
A chest compression. Good job. Thank you. That's it. So be careful of the way they present DNR. DNR does not say the patient should go and die. In DNR, the only thing we don't do in DNR is chest compression. Don't rub my chest to keep me alive. Every other thing that can keep me alive can still be done. Patient can still be on NG tube. Patient can still take tracheostomy. Patient can still go for endotrachea tube. Anything that can still make this patient alive will still be done. So the aspect of DNR, it looks so simple, but it's very technical. But if you know the content, anyhow they bring it, you know how to decipher it. Which task is appropriate for a nurse to delegate to a UAP? So we just want to look at what is the most easy thing anybody can do without having any intense education. So assisting with bathing is almost the best for this individual. A client expresses confusion about their upcoming surgery. What should the nurse do? Patients say, I'm not really sure what you guys want to do. We all know that before we go for any procedure, who does an informed consent? It is only a doctor that initiates an informed consent, especially for all this surgical procedure. Now, patients say, I'm not sure. I'm confused about what you guys told me yesterday. And then I'm not the one that initiated it. So the person that started it must come and complete his work. Contact his surgeon to explain the procedure again. It is not you that because you don't even know what they want to do. Yours, you were just standing there. Yours is to witness the signatory. Patients endorse their signatory into the informed consent documentation. Some hospital, the nurse will have a place to also sign. But most of the hospital, the nurse does not have anywhere to sign. Doctor stay, the nurse stay with the patient. as well as the patient is there. The doctor will say, we want to cut off your two breasts. This is what we are going to do. This is the side effect. This will be the complications. These are the alternatives after cutting the breast. You're going to be using a prosthesis. So everything about that procedure will be explained by the doctor. The nurse will just stay there. You know it, but that is not your scope of practice. Even though you know what to do, you know what to tell this patient in this case story. So many people try to jump above what our scope of practice is. What is our scope of practice is what you still want to maintain in that situation. So that is that. So we just contact the surgeon, let him continue the process. The nurse is part of ID team, which action demonstrate effective collaboration. All these are management questions. And each time you see management question, you just want to pray. Anytime you see it, quickly pray before you go about it. Because they are random questions that they speak all about. It does not really have any major content like that. It is not like our basic medical surgical content that you have crammed already. When they ask you asthma, COPD, pericarditis, myocardial infarction, you cram the signs and symptoms, you know them already. When you see the case study to process it, and you know how to go about the 6 items. So if somebody is good about the aspect of the 6 items, you also want to boss up your game on management, which I always advise. Any of the question banks you are using, any of those three popular ones, make sure you at least do all the management questions there before you go for the exam. I guess you would have well over 34 or 35 of them. Archer has like 45, bootcamp also have. So just get yourself exposed to them a little bit. It's not going to be word for word like that, but you just want to know what are management questions. Are they asking it? It's just going to be in your face. You'll be the one to make a decision on the spot. So, and when we say decision on the spot, they are random questions. They will just tell you a doctor is telling the nurse your boobs is a little bit larger. How will the nurse respond? There's no content about that anywhere. There is not written in any textbook. You just have to figure out what is the best communication for me to respond to this particular doctor that is being uncivilized. So you just decide on that situation. So the best here is sharing relevant client information with the team during meeting. Because that is you just have to look at each of them. The one that makes most sense for you in the management questions will be the one you go. And also reviewing the client advance directive, which statement indicate that the nurse understand the purpose of advance directive, something in advance. It specify the client which is for the medical treatment if they become incapacitated. And who can tell us the two types of advance directive that we have? So the one I expressed now is one out of it. Who can tell us we have two types of advance directive? The one for B is one, and we have another one. Miss Sabina, go ahead, ma'am.
We have instructional directives and the healthcare proxy advanced directive.
That's a good one. Instructional directive, which is the living will, otherwise known as the living will. And we also have the healthcare proxy, otherwise known as the next of kin, the next of kin of that individual. So those are the two types of advanced directive. I ask this in a simple way. You're supposed to know the major content about it in any way they bring it. They can bring it in form of the instructional directive. This is the instruction I am given. I am telling you guys, the moment I cannot make a decision by myself, in case my brain is not functioning, in case my heart is not pumping as expected, in case my lungs are not functioning, these are the things I'm expecting you to do and not do for me. So patient will make an instruction in advance. Instructional directive, that is otherwise known as this person is giving you what? A living will. While I am still alive, this is what I want you to do for me. Now, but we have to be careful about that. We also have a testamentary will, which is the one initiated by the legal practitioners. Those are the ones that will come and tell us, okay, we don't know whether you can make it out of this condition. Can you tell us the number of houses that you have, your cars? How do you want to share it among your family? That is testamentary will. We nurses, we take care of the living will. why the legal practitioner takes care of the testamentary will of the patient. And the other one is the one of power of attorney. You are getting something like someone like an healthcare proxy. Can you be the one to make a decision for me when I cannot decide by myself? Those are the two that we have. Anyhow, they want to ask it. If you know the content of the two, you'll be able to do any questions about that. A nurse needs to delegate tasks to a UAP. Which tasks should a nurse delegate? Just look at what amongst these tasks will not require anybody to go to school to do it. Always use that mechanism or that principle for UAP, because in the exam, they have truckload of UAP. The one for LPN, it is easier. We all know that all nursing tax is what an LPN can do. The only thing they don't do is they don't eat biscuits, they don't do EAT, and they don't do a BIC. We have a formula for that. LPN don't eat biscuits. They can do every other thing. RN does everything except what? Initiation of medication. They don't prescribe medication. So those ones are easy to know in the exam. But in the aspect of UAP, because they are petty things that anybody can do, that is the one they have a lot of them. It's going to be new in your face in the exam. But what's the best principle? Which among you symptoms or these tasks will not require me to go to school to do it? If you use that principle, even if you've never had or you've never seen any of this UAP principle they are presenting to you, you can use that method to pick the right answer. So anybody can do vital signs without having any intense education. A client with end-stage renal failure decide to stop dialysis. How should a nurse respond? In end-stage renal failure, that is the one that will require dialysis. The moment they still have acute kidney disease, we can still manage with some fluid, medication, and the likes. But the point they get to CKD or uremic syndrome, we need to do a dialysis. So how should this nurse respond? She say, I want to stop it. So we respect the client decision and provide support. Maybe he's tired. The moment he say, I want to stop, the next thing they're going to do is to place the patient on hospice. Because if you stop taking your medication, the dialysis is a medication for them. There's no other solution. When we say a patient has a CKD,
9, right?
which is end-stage renal failure, 95% of the kidney is packed up. 50, patients say, I don't want to do this anymore. So you can see it in another way in the exam. They can say, 50 call the hospice people. That will still be your answer.
This is
because the person will die. If you don't do a dialysis in 6 months, the patient will die. Automatically, you'll be thinking in the aspect of hospice. I made it simple. It can be more tightened up in the exam.
Thank you.
So the moment someone say, I don't want to do a dialysis, then the next thing is to do a palliative as fast as possible. The nurse is involved in quality effort. Each activity demonstrates participation in quality improvement. This is an example of management question. See them asking you management question, you also want to change with it. The moment your exam is changing, you will know that I've been doing maternity. Now they change me to pediatrics. You quickly want to change because the first 3 pediatrics they give to you, they will quickly make a decision as fast as possible. So if peradventure they change to pediatrics and the person failed the first 5, that shows that the nurse is weak in pediatrics. They will give more of pediatric question and the person will fail out of the exam. So the way the exam operates is different from the way we mark our normal nursing school exam. This is a computer adaptive testing. We are testing your strengths and weaknesses. So you don't want the computer to understand or to be exposed to your weakness. You still want to be gallant. For every 10 concepts they are giving to me, I want to try as much as possible to pass 7 out of that case study or that particular content they are giving me. If you get 2 out of 10, that shows that the person does not know that particular content and they'll bring more on that particular system. So this is management. Many students are crying. I don't know management. If anybody is telling you there's one major big content about is a lie. Even in Sanders, they only did about like 6, 7 pages about management. It's just to let you know that it's more of a commonsensical question. Commonsensical question. We are trying to know how many people understand that I will not only know nursing. Because I'm a nurse, it does not mean I should not know what is going on in the society. Right now, they said the president, one of the ex-president, died yesterday up to this morning. So I'm so sure that if you ask some people, they will say, are you sure? Which president died? Because the person is saying, I mean, also, my own is to just only give injection. I don't know anything. Oh, no. You must be a polyvalent nurse, a jack of all trade, master of all. That is why we are center of everything. A nurse is the center for everybody. So that's it. So that is the reason for all this management question. How can you think outside the box? We know you have crammed myocardial infarction. We know you know angina pectoris. Yes, that makes you a good nurse. Now, if we are asking you something that is not related to anatomy and physiology, can you still operate there as a nurse? That is the reason for those management questions. So don't run away from them. When you see them, have it in mind. I'll read it and I will pick what I think is going to be the best. The answer is going to be flashing in you. It's not as bad as we think. It's just that it requires more critical thinking more than other questions. Why? The other questions, we all are used to the content. We have crammed the content. So when you get to the exam, they don't ask you those one, and they're now asking you the one that will make you to do thinking outside the box. So many people will say, I don't know, I should have prepared for it. If you use 1 year to prepare for management, it's a waste of time, right? You just want to start praying that the moment you see the management question, just say, God, I need you to fix this for me. It's not those general things that all of us are exposed to. You just don't want to look at it with normal eye. So the best here is collecting data and pouring it in units. All other one looks good, but you cannot even ignore any incident reports. Delegating all quality improvement tasks to UAP, that is not even right. Anything quality improvement must always be for a nurse. And the word all also has given out that particular option. For Naomi, we always want to avoid any option in NCLEX that has Naomi in it. Naome. N is N raised to power 2. E is E raised to power 2. O is, so all the words that has Naomi in it, we are going to avoid them at least 95%. Let's do a little bit of brain exercise. Who is going to tell us the meaning of Naomi? Which are those words that you want to avoid? That once you have them in your option, they will likely not be your answer in the exam. It's a giveaway for anyone. So who's going to try? Naomi, what is the meaning of Naomi? Miss Sabina, go ahead, ma.
N is for never or none, and
Okay.
A, all or always, O, only or often, M, many or most, and E, every.
E, every. Good job. So for those that are just joining, make sure you know Naomi. It's like we are going to farm and we are well prepared with our tool of trade. That there are some times that your content is going to fail you. When your content is failing, to be candid, it is extremely too much. We've been there and we understand what it is. That is the only brick wall in nursing, passing NCLEX. The moment you pass it, it is better at the other side. It's still gonna be kind of, but not as too cumbersome like NCLEX nursing. And there's a reason why they do it like that, just to make us to appreciate the profession itself in the long run. A client is scheduled for surgery and does not have a signed consent form. What is the nurse best action? Patient does not have a signed consent form. Notify the surgeon immediately. Nobody is going to do that. So that means nobody has explained the information to the patient. If there's no consent form signed, that means that nobody has explained. So someone has not made an explanation and the patient has not signed. A nurse noticed a colleague shouting vital signs that were not taken. What should the nurse do first? What is the first thing to do? You just never confront any nurse because it is still allegedly. You want to be careful, even when you are sure. So on no account can you confront anybody. They can bring it in form of an impaired nurse. A nurse noticed that someone has already stolen tramadol. A nurse noticed she counts the opioid medication. She noticed that some of those opioid substances is already missing. Anytime you notice that a nurse has refused to do something pertaining to the patient or they have stolen medication, Never confront, never pick options that say you should confront the colleague. Why? You are still not sure. What if you are not right? So to be on safe side, you just want to report to the right authority. Report the incident to the child nurse. A nurse is providing discharge teaching to a client, which statement ensures that the client understands how to manage their care at home. So this is positive, positive statement. How do I know that the patient can take care of themselves at home? Can you review the instructions again to make sure I understand everything? So that shows that the patient will do it. If he says, can you repeat it again? That means the person is interested in what you are saying and they're likely going to do it. So that's the best. It also is part of editing, discussing client care plan, also management. I deliberately bring a lot of management because many people are saying, I guess we are struggling about it. First of all, change your concept about I don't know it. The moment somebody say I don't know something, they won't go for it. You can see we just had a question now. Patient wants to know more. Said, can you repeat it? So what you think you don't know, you just want to give more time to it and get to know it than to keep saying, I don't know, I don't know, I don't know. So with this, what is the best? Listening to and incorporating input from other team members, like you are doing something like a democratic kind of a leadership. A client asks about their right to refuse treatment. What is the nurse's best response? Do I have any right to refuse treatment? Yes, why not? You have the right to refuse treatment. Even a psychiatric patient, if you see in one of the boxes in Sanders, a psychiatric patient also has a right to refuse medication until the psych nurse practitioner or the MD comes to do an assessment, they evaluate and they say that this patient cannot go. But at that spot, everybody has the right to say, I don't want medication. A nurse is preparing a client for discharge who requires home health services. What is the nurse priority action? So what is going to be? Contact the home health agencies to arrange the services. That will be the best. Let them know as fast as possible. The nurse is reviewing a client chart and notice conflicting medication orders. What is the best action for the nurse to take? Something is not right. They are all confusing. So what is the first thing to do? Always clarify with the prescriber. So this is always very, very high used in different ways in the exam. So they will say, call the supervisor, tell the child nurse. Telling the child nurse and calling the supervisor, which patient would have died. Patient, because those people you are calling, they don't also have the right to modify those things that is conflicting. So who is the best person to call when we have a problem with medication? It is always the person that prescribe it. Maybe you are trying to call him to order. Can you make a prescription of the digoxin 50 milligram? And that is suicide automatically. You're supposed to put 0.5. Maybe the doctor was kind of, maybe he just got carried away and put 50. You can always call him to order. So you calling this DON or the child nurse is not going to work at that time. A client needs an interpreter for discharge instruction. What is the nurse best action? So use a professional interpreter, which is always the best. Which is always the best. Anytime we see an option that says we should use the professional that is trained in the hospital, is always the best for us. A client has an advance directive order. First statement by the nurse best explains the purpose of advance directive for the patient. It outlines what the patient wants and what the patient does not want as fast as possible. It also observes a colleague failing to wash hand between clients. What is the best most action for us to do? Remind the colleague about the importance. Can you do your hand washing, which is always the best for her. Just a reminder because anybody would have forgotten to do that. A nurse is planning a care for a client who is at risk for fall. Which intervention should be included in the care plan? So just place the client's call bell within reach for that individual. So go further. A client asks the nurse to explain the benefit of having healthcare proxy. What is the best nurse response for that individual? It allows someone you trust to make healthcare decision on your behalf. And that is the second aspect of advance directive, which I've already explained. The nurse is reviewing incident report. Which incident requires immediate follow-up for this patient? Which one will require me to follow up? So I'll just say which one will require a more intervention. Which of them is bad amongst them? So a client that just developed a pressure ulcer, I guess that will require me to do more intervention. A client who fell without injury, there's no injury. So they have made us, there's no injury. The modifying phrase is very important in prioritization. The modifying phrase, patient does not have any injury, that is good. Patient does not have any adverse effect, that is good. A near miss medication, it is a near miss. I nearly wanted to do it, but I did not do it. So that means there was no problem at all. So C is the only problem here. You use that to take care of that. A nurse is caring for a client with terminal illness who is in severe pain. What is the nurse priority action? So just administer the prescribed pain medication for the patient. A nurse receives a client's lab result showing a critical value. What is the nurse best action? Notify the HCP as fast as possible. The moment there is a bad situation, the first person to call is that, not the DON or anyone. A nurse is preparing to insert a catheter. Which technique is essential to prevent infection? Is always going to be what? A sterile technique at any point in time. Whether it is the straight catheter or the bag catheter, must always be a sterile technique. A nurse is disposing of a used needle. What is the proper way to dispose it? You place the needle directly in a sharp container. As a matter of fact, we are using a needleless devices now, and you don't have to go through all the stress. But because of exam, we just have to go for B most often. A client is in isolation due to highly infectious disease. Which action by the nurse is most appropriate for this patient? Disposing of before leaving the room. Highly infectious is always just better. Just dispose it and you don't get people exposed outside the room. A nurse is using a mechanical lift, which is all this oil lift. So what is the best method to go about it? Always, anytime you want to use an assistive device for the patient, it's always better to get a second nurse if the person is available, if available. A nurse is teaching a client about preventing infection. Which statement by the client indicates a need for further teaching? When it is need for further teaching, something is wrong. That is a negative statement. Anytime we see need for further teaching, you are picking a negative statement, a bad situation. So I can reuse if I wash them. So if you want to reuse your PPE, then something is not right. So we are going to educate the patient further. In NCLEX hospital, we don't lack anything in NCLEX hospital. So even if they say that is the last glove, and if the patient remove that one, there won't be anyone to use again. Don't get trapped. We don't lack anything in NCLEX hospital. Everything is always going to be efficient for the patient. What is the most important reason for the nurse to implement proper body mechanics? So it's just to prevent injury to the nurse and the clients. So that's always the best for that individual. A nurse is caring for a client with surgical wound. Which intervention is most effective in preventing infection? It's always to maintain a sterile field, and we don't want us to be crossing across. Just don't go across the patient at any time you are doing dressing. C will be the best. A client requires the use of restraint. Which action by the nurse is most appropriate? Secure the restraint to the bed frame. We always want to use the bed frame and not the rail, not the side rail. Always better to attach to the frame and not to the rails. Always better to attach to the frame and not to the rails. A nurse is conducting in-service infection control. This is also management. Which points should be emphasized to prevent a spread of infection? Always perform hand hygiene. At every point in time, hand hygiene will always be our best at any point in time. A nurse is setting up a sterile field. Which action contaminates the sterile field? When you are reaching over the sterile field to retrieve and heighten, you don't want to go above. Just don't go across it at any point in time. Which statement by the nurse indicate the need for further education on handling hazardous materials? Further education, further instruction, a negative statement. What is the patient saying that is bad? So patients say, I can mix chemical if their labels are saved. No, you don't want to do that. Mixing chemical, it can be extremely dangerous for the patient to do. A nurse discover a small fire in the client's room. What is the nurse first action? Who can tell us the formula, the drag and drop for fire? Okay. You are raising your hand, raise it well so I can. Mr. Mololano.
Yes, ma. It's race.
Okay.
Rescue, activate, confine, and extinguish.
Extinguish. So, okay. So let's do pass once and for all. We are now doing raise or pass.
Yes.
Raise or pass. We have added O to what we have already. So what's our O?
can't remember the, but I know the P is pool.
Okay. Okay.
Mm.
Go ahead, please.
O is oxygen, right?
No, you obtained the extinguisher.
Obtain. Okay, obtain.
Obtain the extinguisher. Okay, go ahead with the P.
Then you pull.
Pull. Okay. This
You
one.
aim. Aim.
You aim. Okay. What do we do with the S and S? Be careful.
You squeeze and sweep.
Good. Squeeze and sweep. Good job. Thank you. So this is the only one that stress people out. The last two S's. They always bring it as a drag and drop. So you can imagine if somebody has tried, you have drag and drop RACEOPA. If the nurse now mess it up at the two S's on the below, that is always the problem some students have. They get to this which one do I drop? Because the two of them are S's. So always have it in mind that the last thing you are going to do is to sweep. After you have cleaned your home, you have done all your high dusting, dam dusting, and the like. What is the last thing to do at home? The last thing you want to do is to sweep. You are going to sweep it up. So that's the last thing. You will squeeze before you sweep. That is it. So as long as we know that, every other thing is going to be easy. So rescue the patient first. Which practice is most effective in preventing needle stick injury? Just say disposing of needle in a sharp container immediately after use. Because if you drop it anywhere, it will be a problem. We don't recap again, we don't break, we don't bend at any point in time. A nurse is teaching clients about preventing falls at home. Which recommendation is most appropriate for this patient? We want to install a grab bars in their bedroom. So all other one, they are not, it's not going to be the best for that, because we all know this principle of fall. Use scattered rug, not even a clutters in their room. Keep their home light dim. It has to be lit. They should wear a proper gripping slippers. And everything about fall must always be yellow, 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 yellow. They say their socks must be yellow for us to quickly identify. Everything for fall in the hospital is a yellow color that we use to connect everything about fall. A nurse is preparing to administer medication to the client. What is the best way to identify that client? It looks so tricky. So look at the client handbag and verify if it's the same with what you have. A patient can tell you something else. So some of them might have been demented, they might have been confused. So they say my name is this. If you believe it, maybe that is not the right name, or we can give the wrong medication. A nurse is caring for a client with communicable disease. Which personal protective equipment is required? So always go for what? Umbrella. If they take it little, 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 take the one that has almost all of them as an umbrella option for all this infection control. You will never go wrong. You will never go wrong in that. So, and we have just established Naomi, only Naomi, Naomi, Naomi. They will never be your answer. Most of the time, 95%. Which principle should a nurse follow to prevent back injury? We've always established that anytime you want to carry a patient, always hold your back straight. Never bend at your back. If you bend at your back, there's possibility of you having a fracture. So if you have to bend at all, you can only bend at your knee. So if they change the question and say bend at your knee, okay, that's good to bend at the knee. And what do you do with the back? You straighten your back, you bend at the knee. That is the normal statement. You bend at your knee and you straighten your back. Any other thing aside that, it is not good for all these oil lift and the likes. Which client should the nurse prioritize for care during a mass casualty? So we just want to triage which of them would die first. So just always say who will die first. This one looks easy. A minor laceration will not die in 10 years. A fractured arm, maybe. Just hold on to that. A sprained ankle, you will not even die in 50 years, so we should be fine. So we are only left with B and C. So most times in prioritization, always do elimination. Eliminate those ones that will not die anytime soon. And you are now going to be left with two that will be challenging. So out of those challenging ones, you now begin to do all the 13 principles that we have for prioritization. You can now begin to break it down one by each. The answer is going to be what's forthcoming. The nurse is caring for clients on contact precaution. Which item should be removed last when leaving the client room? So which one do I remove last? So we always know that we have formulas that we use for when you are entering the room of the patient. We have a formula that we use as a PPE, and when you are getting out of the room, we have a formula. So what formula do we use for donning PPE? Don. And when we are removing it, we call it doffing. Doffing. Doffing means remover. I dove my hat. Donning means I'm putting on something. So who will tell us the formula for donning PPE? We have a formula for it. Miss Tini, go ahead, ma.
So for donning of PPE, the first thing we do is to
Use the
put on
formula. Okay, go ahead.
the first thing to do is to put on the gown. After the gown, you wear your
Gown
mask.
for donning? For donning?
Yes.
Okay. Gown,
Now
mask.
first,
Mm-hmm.
mask.
Mm-hmm.
Then you wear your Google before the glove.
Okay.
Glove is the last.
Okay. So now the next one is
Dolphin.
GGM.
Dolphin. Yes. You put on you remove your glove first. Then the other G is the Google, gown and mask.
So if you know this formula, it's going to make life easy. Donning and doffing. In donning, you do GMGG. When you are doffing, when you are removing it, you do GGGM. So if you, I'll just quickly write that in my exam down somewhere. So then this question say, which one do we take out last? And this is doping, and marks is this, and that settles that. As simple as that. The moment you have enough content, it makes a lot of confidence. Despite the fact that it looks so fundamental, some people might still find it challenging because they ignore those fundamental things. They cram everything that is all those big things. The moment they notice that the nurse does not even know those fundamentals we are expecting everyone to know, the person will not even get to those bigger questions that she has crammed. So on no account, as we are really struggling to know our engine, you still want to go by what is right for that individual. Okay. A nurse find a medical error in a client chart. What is the best? Report the error according to facility protocol. What is the primary reason for using standard precaution with all clients? Why are we using it? To help prevent infectious disease. That's the reason why we are using it for all our clients, basically. Which action is appropriate for a nurse to take when client has a seizure? If patient has a seizure, what is the best thing to do? You protect the client from injury. So if they are sitting down, you place them down on the floor. If they are standing, you also place them down on the floor. A nurse is teaching a group of clients about hand hygiene. Which statement indicates a need for further teaching? Hand sanitizer is an effective substitute when my hand is visibly dirty. Further teaching means patient is saying something that is negative. So you're going to look for a negative statement. Further teaching means something is not right. The statement is not right. So patients say my hands are visibly dirty and I can still use hand hygiene and sanitizer. The best is going to be hand washing for the patient. A nurse is preparing to use a fire extinguisher, which is the correct method. So she has already told us what we are expecting. We have done race and I'm connecting pass with it. And don't forget that we have added O. You must always obtain, don't forget to obtain your extinguisher before you begin to pass the extinguisher. You raise in the aspect of patient and go and obtain the extinguisher and begin to find a way of taking out the fire. So it's going to be BASS, pull, aim, squeeze, and sweep. You're going to always be sweeping last. And lastly, a nurse is performing a dressing change on a client with a pressure ulcer. Which action best prevents infection? So always sterile dressing or sterile using sterile technique at every point in time. So every of your question, you will ask your questions. Let's allow those that pass to give us their testimony and what they went through. And there's two people were able to go. They went to Florida. So if you are a Florida person, please as fast as possible. If you went to Florida, quickly pass that exam as fast as possible. I guess they have gotten to the terminal stage of the Florence Nightingale process. So they have dropped everything for FBI now. So all the licenses that we have, each time you are struggling to get a transcript for most of this close school, we have the opportunity of going to Florida Board of Nursing to get to get our transcript. So you can always tell them, I need my transcript, they can help you send it. But now they have enforced the Florida Board of Nursing to take all the license to FBI. So the opportunity of getting of getting your transcript from Florida, they wish to help. They are now also incapacitated. So getting to FBI, calling them to wanting to get your transcript is going to be a whole lot of stress. Is to enable or get people in trouble. They're going to be asking you a lot of questions, and that can even end somebody in where you don't want to get to. So if you already have an ATT right now, and you know you have gone to all this Florida school, don't sleep on it. Do everything in your power to pass that exam. Go and do prayers. Call people to pray for you. Do what you got to do. You just got to do what you got to do to achieve this thing as fast as possible and get out of it. When you pass it, then the next thing we want to do is start discovering, start talking about it. The person that had problem last week, we've been able to fix her. She was able to get one or two people to help her out. So it's a community where if you talk out, we'll find a way of helping you out. So it's the people that went this week that were able to give us that information that, and we quickly let everybody know that everybody should go. Anybody that wants to test, go. And if you actually went to Florida school, all those Florida schools that has issue, if you didn't go to those schools, you don't have to bother. So they have gotten to a place where it is now on FBI level now. So everything that has to do with cases is to be one stage after the other, one stage after the other. So even people that went to another school and they try to they are trying another board, they are frustrating those ones also, that because you went to Florida school, we still need a transcript from you. This person has gone to a new school just to make them, just to get them frustrated. This person has gotten to a new school. They are still saying, we have Florida in your name. And so even though you have gone to a new school, we still need the previous transcript of that, which they know you cannot provide, right? So now you have to now go and fight it. So until you now be able to call FBI will now find a way of taking that particular school from your name. So you don't want to sleep on it. Find a way of passing as fast as possible. With prayers, all things are possible, not even our power, not our might. So let's see. Let's allow the people that want to talk. Who is going to talk first? Who is going to be the first to talk? We have Miss Josephine, we have Miss Ronke, we have Miss Aisata. Who is talking first? If you are here, let me know. Let me unmute them. Let me unmute everyone. Let's not make it rowdy yet. And talk now. Congratulations, ma. You can go in, ma. Come in, ma. Miss Ronke. Miss
Good evening, everybody.
Good evening.
My name is
Congratulations.
Thank you very much, ma.
Congratulations, ma.
Congratulations, Miss Ronke.
Congratulations, ma'am.
Thank you very much.
Congratulations.
Congratulations, Miss Ronke.
Congratulations.
Not wrong.
Congratulations.
Congratulations.
Thank you, everyone.
Congrats.
Congratulate you
Congratulations.
soon too. Thank you, thank you,
Congratulations. To God be the
thank you very
glory.
much.
Congratulations.
This is how I will congratulate all of you very soon in Jesus' name. Thank you, everybody.
Amen.
Amen. Amen. Amen.
First of all, I want to give thanks to God, the Most High. Secondly, to Dr. Kemi for all of our support. In my sleep, if there's anything I ever remember is be intentional. Be intentional. I always remember that. Even my husband would laugh at me and said, be intentional. I also want to give thanks to my friend who introduced me to Dr. Kemi, Sister Lamide. God bless you. So I just want to say that we have to be intentional. What I do is that I listen to the audio. When I listen very well, I go back on my Acha or UWall. I take a questions that pertain to whatever topic I've listened to, and I do the questions and I see how well I do. If I do well, then I know I understand. Then I move to the next. But if I don't do well, I go back again, I listen, then I go to a different bank again and I take questions again until I understand every chapter before I move ahead. And that really, really helped me. There's one question I will not forget, the rules of 9. I was about to enter the exam hall. I just flipped through all my jotting and my jotting. I saw, oh, rules of 9. I looked at it again. And I said, when I got to the exam hall, I drew the person, like she said. I put the number on the head, the body, I wrote it down. I didn't even know I was going to have that questions, but I didn't want to forget. In the middle, I just saw the questions. This person has bonds here, bonds there. How many percentage will it be? I went back to my woman being that I drew, and I went to calculate, and I saw the answer that matched. And I was so excited. I was like, oh my God, this has really been intentional because this is really working for me. I had six, I don't know what it's called anymore because I did my exam in April. The 6 new gen questions. I had 6 of them. I had neuro, infection control was a lot, and I can't remember, and also management questions because they were asking me questions about population of some people that had diabetes, some people have HIV. In the following year, it was just questions I didn't even understand what it was. But it wasn't nothing that has to do with NCLEX. I had about 5 of them. I read through the question, I read and read, and I just used common sense to answer. And when I got to 84, it just says loading. And that was it. I was like, oh, 84? It didn't even get to 85. I was like, is it 85? I don't know. I just got up. But I was very confident because I was like, this looks very easy. If I knew it was this easy, maybe I'd have taken the exam long time ago. But I said, I just kept my mouth shut. I didn't say anything because I was afraid that what if I failed? And the next morning, I went to a Florida school. I got an email at 6:30 saying congratulations. I was so happy. So I know we are all able to do this. It's just about being intentional. I just think that let's read into every questions because the questions are technical and some of them are English. English sometimes can mess us up because some bath and shower is different. But when they put it in that question, we can make mistakes. So let's read the questions very well and God will help us all. Thank you.
Thank you, thank you,
This
thank
is
you,
the
thank
first
you.
time I'm doing it.
She said,
Yes, this is
it's
my
Miss
first time.
Rocket. Is that your first attempt with it?
Yes,
Ready?
Congrats.
First time
thank you.
testing
You say bath and
before.
shower is different. How do you mean?
Yes, when they say a bath and a
Yes,
shower, it's different. It's different in
it's
English.
different.
But for
Yeah.
what, if you want to go by our own method, I took my bath, I had a shower. That is in English, our own where we come from. But when you are doing it in the exam, it's different thing. So when they say a patient has went for an abdominal surgery, the person cannot do a bath, cannot be in a bath because of what there's still a wound. So she's going to be what's transferring that microorganism back to her. So she will just do a single shower. So,
Okay.
and they'll put the same thing in the exam, and you'll be thinking it's the right thing. So reading in between options matters a lot. And that's why I said everybody has to be praying for the spirit of what? Patience. Many women don't have patience. You just have to educate yourself, work on your emotions, try as much as possible to help yourself for this situation. A lot of people would have passed. They are using their normal life to attend to endless questions. No matter how tough you are or how restless you are going to calm down and calm down and be reading as if you are in elementary school. A nurse is performing a dressing change. Let them say this one. She doesn't know. Are you dumb? Yes, so let me be dumb for NCLEX. When I pass, you will not say I'm dumb again. I think that is the best. So we don't want to be too just believing that is it not just for me to read? No, for what she just expressed now, it makes a lot of sense for that. So that's that. Thank you, ma'am. Thank you
Yes,
for
ma'am.
coming.
Oh, my
We appreciate.
pleasure.
Yeah,
Thank
Thank
we
you.
you.
appreciate. We still have more. Miss Josephine. She's a first time test taker. Most times, those first time test takers they don't really have much experience like that. Experience in the aspect of how
Dr.
the exam.
Kemi, I'm not first time taker. I'm third.
Which one is who is the person talking now? Is this still Miss Ronke?
No, it's Josephine.
It's Josephine. No, I was talking the first time.
Oh, no.
Okay,
Remember,
so go
you
ahead.
always say third time test when it's not your first time. That exam is not easy. It wasn't easy.
Okay, so congratulations, ma'am.
Thank you. I want to start by thanking God and to thank you, Dr. Kemi. I joined this class 2 weeks to my exams. When my whole having the ATT was just a whole long story. They gave me an ATT where it's just 1 month and 1 week because I've been, if I'll cut the story short for that, but I had a 1 month, 1 week. I reached out to Dr. Kemi and she told me her classes will start on the 26th of May. I didn't have time, so I said I wouldn't. But around 2 weeks to my exam, I was a little bit tense and something kept telling me to still reach out. I said, okay, it's 2 weeks. And I didn't have that much money. Maybe if I reach out now, she's going to give me cheap. But I called her. She said, even if it's 1 day, it's still 800. And then I said, you know what? I'm still going to pay. I paid. I took those videos to the library 10 hours every day or 8 hours minimum every day, listening and taking notes. And by the time I would sleep even with her voice, I texted her, I said, your voice is so comfortable. Like your voice is, it's making me feel like I already passed the NCLEX. And on the day of my exam, I was using you all. The day on my exam, I did the assessment and I got a very high chances. Instead of me feeling a bit relaxed, no, I got so tense because my last exams, my time cut me short around 135 question. I didn't finish. So I was so scared. I went in there. That's why I had to spend days, hours at the library, like 10 hours, because I knew she always say, if you're not the first time taker, I don't think they'll go. Like my exam, all those precautions, those safety, I didn't have them. All those UAP, who to see first, I did not have them. I'm like, yes, this thing is tough. When I was doing the questions, I got to around 40. I felt comfortable. I'm like, oh yeah, I'm doing great. I'm going to pass this exam. Immediately I said that within me, the questions started getting tough. I'm like, oh my, is God listening? Maybe he thinks I'm proud. I took and then few questions ahead, he said, do you want to take a break? I said, yes. I put my hand up. I went to the bathroom, closed that door, and I went on my knees.
Good.
I said, God, are you not the one that changed water into wine? You will change those questions to something that I'll recognize. If I don't recognize them, take me to the answers. Take me, because I'm not leaving this place without my license.
Good job.
Amen.
I said, I'm not leaving this place without my license. And when I came back, the first thing I punched on that, the next question I clicked was something that I knew to my fingertips. I was like, is God actually, like, is this magic?
Yeah.
Yeah. And it started going. 85, I thought I'm going to stop. No, it didn't. Oh my God. I started feeling so furious. But I'm like, I'm still in the game. I'm still in the game and I can do this. It took me all the way to 150 questions. I left that place crying, but within me, I'm like, I saw a lot of questions that I know this is the answer. Like I was sure. I don't know why it kept taking me going all the way to 150. So I just want to say the God that did it for me is going to do it for everyone, but you need to put in the work. And
Amen.
yeah,
Amen.
yeah,
Thank
put in
you.
the work, stay confident. When it's tough, call upon God. I swear to God, that man is listening.
Mm.
It's like he is. He is. I went to the bar. I did not pee. I kneeled down, held the toilet pot. I said, this is my war room. God, turn those questions around. I don't know. They started asking me education on what, some kind of stuff. I don't even think that's NCLEX stuff.
Yeah.
I was so confused. I'm like, what is this? I say, I pray for break to come. And then, boom, break came. When I came back, it turned around like a roundabout. It turned around, like seriously. So thank you so much, Dr. Kemi. Your voice, oh my God. The way you break down that Saunders was the worst book I ever wanted to touch. But listening to your videos, I had Saunders closer to me. And luckily I had 7, the same one you always recommend. So I will go line by line, all the videos within that 2 weeks. And I finished all my You Walk Your Back and did all the questions that I failed. I finished everything. So I was really, really prepared.
Yeah.
Thank you
10
so
hours, 10 hours it's not a joke every day.
Yeah. Thank you so
I
much. Thank everyone.
the
Thank
most
Congratulations.
Thank you.
was it 2 weeks ago? Was one of those ladies that came.
Jojo.
She also said
Thank you.
10
Miss
hours.
Pepe.
10 hours. Yeah, she came in.
Yeah.
That was 2 weeks ago.
Yeah, the day the lady was saying 10 hours, I'm like, oh, this is my twin. There's a
So
lady
this
that asked me at the
within
library,
10 hours.
don't you even go to pee? I said, I just like, you don't know what I'm facing. They always say third time is a charm. It must be a charm for me.
Hmm?
Hmm.
Yeah.
Yeah.
So
Thank you.
these are the people who need 10 hours to read every day, and they are still alive. So if you are that one that is believing that, oh, it's too stressful, nothing is going to, it will, I've never seen anybody that die of hard work. Never. Never. It will be as if you want to, but it's not going to be like that. Now they've forgotten about it. Even if they see anywhere they write A in a paper, they won't read it again for another 2 weeks. Why? Because you just want to decompensate. You just want to decompensate and say, you know what? Anything that is about book, I'm not even interested. Because you want your body to come back to the normal level you are expecting. So everybody you will laugh last. We just need to put in a little bit of effort to achieve it. It is very achievable. That is, if you believe it. And I like the affirmation statement. She went to the restroom. She did that. Some people will go 2 days before the exam. They will go and make a declaration around the place. If you are able to do that also, that also works. As long as, please, if you have a background noise, it's better for you to get out of the class to make life easy for every other person. So that also works a lot. It has proven to work, and they will come and say, ah, I just did my home part, but God fix it. For everything you are doing, always believe that it is only God that can do it. It's not by our power, not how strong you are. You just want to key into the fact that God has done my best. I want you to help me. And I always say something: good things come to good people. When you are bad, you know you are bad. You know by yourself what you are doing that is bad for another person. You know. If the prayers is not getting answered, go back to that four corners. God, help me. I have done something wrong. Get away from it for it to be easy. For it to be easy, let's put ourselves in God's shoe. If anybody do anything bad to you, will you like it? You won't like it. You will want to revenge. We have 1 million. Well, we don't even know the population we have in this world. A lot of us are calling on to God. Even people that are being righteous, He has not answered the prayer, let alone someone that is doing bad. So always have it in mind. I have an exam to pass in the next 3 months. Everything that will put me into sins, I will detach from it. I've always believed in that. Some people don't pray at all. They're just good people. They're just good in all ramification, and everything works for them. Why? Because they are very direct, they are very authentic, they are not manipulative. Everything about them is pure. And they will say, I'm not really prayerful like that. Oh, you do. It's not about prayers at times. Also, it's about characters and intentional behavior, as I always say. So Miss Aisata, I guess she said she's still at work. So she's the first person we are expecting. After that, Miss Ada, if you can talk now, I guess she's the one that has issue with Florida this past week. Then any other person that want to make their presentation, please quickly let us do that. And some people were asking me questions about how to do application. This
Good
is
evening,
the
Dr. Kemi. This is Mr. Eda.
I say that good evening, ma'am.
Good evening, everybody.
Congratulations.
Good evening.
No congrats here too.
Go ahead, ma'am.
So I spoke with the Florida board. I called the Florida board. Why? Because I went to school in Florida 2018, 2019. I don't have anything to do with them anymore because when I heard they have problem, I went back to school in 2022. I went back to school in Texas. So and I did not do anything that has to do with Florida to go to that school. I had about 111 credit unit from my community college here in Dallas, Texas. So that's what I used to get into the nursing school here in Dallas. So when I called Florida board said they don't have anything that has to do with transcript from that school. Since 2 weeks now, I tested the group. I said I needed some numbers, like Florida number to call. Some people send me some CIA number to email them. That's where the transcripts are. I emailed the CIE. The CIE replied me back and said the school that I went to is confiscated by the FBI. So they put an FBI number there that I should call, which I did. I called the FBI. They took all my information. At the end of the day, the lady said, well, she will give my information to the FBI. They will reach out to me. Still, until now, I've not even heard anything from them. They didn't call me back. They didn't send me message, nothing. So then I reached out to Dr. Kemi. Dr. Kemi said, okay, I need to call Florida board. Probably that's where all our transcript is going to be. So, or I have to go to a different state, apply new application to a different state. So meanwhile, I waited on Monday that I called the Florida board. I started calling from 9 a.m. I finished calling everybody till like 4 p.m. Like I was stressed out. I was feeling headache. So when I called Florida board asked me all the questions in the world. Did you use the school? Did you use this transcript from the school to get into your new school? I said no. At the end of all the questions, they said they don't have any transcript with them especially from that particular school. That those schools, they gave all the transcripts to the FBI. So there's nothing that has to do with the school. All the schools that is affected, there's nothing that has to do with, like they don't have any information about the school anymore. So the case is now with the FBI. They drop all the transcript to the FBI. So it's now left with the FBI if they will have to release the transcript or not. I was like, God, this is I took NCLEX, this year. So like this is happening to me. So then I said, okay. She now said, okay, what she will do for me is to transfer me to uh, Department of Education in Florida, which I said, okay, let her transfer me. She did. She gave me the number. I think she gave me the number or she transferred me. I can't remember. Then I waited. She transferred me. I waited. Then the lady that also picked, she now said, oh, you need the transcript? Is it from high school or from college? I said, no, from a nursing school. She was like, okay, hold on, let me transfer you. She now transferred me again to the first independent something that somebody wrote it on the group that I should call. She now transferred me there. So I cut the call. I have to call again, call Florida board again, Department of Education again. I told them that the number you transferred me to, I've already done those process. So there's no point of you transferring me to that place again. So that's when she was now saying, okay, hold on, let me put somebody else online. She put me on hold. The another lady, I think that lady, she's an advanced lady because the way she was talking. So the lady took her time to ask me all the questions. She was like, ma'am, we don't have any transcript with us. I understand that this is Department of Education. This is where you can get the transcript, but we don't have any transcript with us that has to do with the school. But if you really went back to school to go and start all over, they don't supposed to use it against you. That's what the lady said. They don't supposed to use it against you. They're supposed to let you take your exam because you didn't use the old school to get your degree in Texas. I said no, I used a different one. So she now said, okay, that that's the only thing she can tell me the only thing she can tell me is that all states have their requirements. If my state is giving me stress, she will advise me to go to a different state to go and put in a new application. That's what the lady told me. So, and Dr. Kemi also said it. So she now said because all states have their different requirements. She now said, or I should also reach out to FBI if they will release the transcript. But she said she doubts if they release it. So I now said, okay, so what if I take a lawyer? Because I need my name to be cleared away from this mess. This is a mess. So she now said that's another option, because since I went back to a different school, it doesn't supposed to be affecting me in any way at all, you know. So she now said if I do a new application in a different state, that I should not put the Florida thing. So I now said okay. So that's how it is. So the information is that anybody that went to the school that is affected, I don't know how severe your case is, but according to what he told me, no more transcript from the Department of Education, no more transcript from the Florida board. All the transcript now is with the FBI. So if there's anybody that also have experience, there's a lady that was talking to me last week on Sunday last week by this time. She said I think the same thing occurred to her. She had to go back to school. I can't remember your name. Please, if you're online, please, I want you to come up. Please, I really need your help. I don't know why you did it. You also said you even requested for your money back, which I wanted. I think it's something I would have loved to do, but that's not really the issue right now because I really need to solve this problem out of the way. Please, if you're online, I will really appreciate it. To also reach out to me or reach out to the group. Anybody that have issue, please. Thank you very much, everybody.
Okay, you're welcome. Dr. Kemi.
Yeah. Hello, ma.
Please, my name is Evelyn and I just joined today. So I just want, the Naomi that you said, if you could just explain it to me.
Okay. I'll bring it on. No problem.
Okay.
All right. Is there
I know.
is there anyone that there's a lady that talked last week that was saying she did one or two things for her when she was moving from Florida to somewhere else. Is it Miss Cynthia or the name of the person? Is it you? The person's name starts with C. We can help out, please. If you have any other question about the Florida
name was
stuff,
Miss Cynthia.
it was Cynthia, right? Okay.
Yes, ma'am. Mm-hmm.
Okay, me, I have a question because I have that situation. My case is similar. I want to ask her.
I have two Cynthias. I'm here, but I'm not moving anywhere. I was
Okay,
just
Miss Cynthia. Yeah, okay.
yeah,
So I
it
guess she
wasn't
said she need your help.
no, it wasn't me. Maybe it's a different person because I'm not moving anywhere. I live in Texas. I went to Care Hope College. It's also in Florida, but my school is still open and they are accredited. And I know somebody asked that question, but there was a lady who said that you can get your money, you can call the board and get your money from I guess the board, if you went to a school where they took your money or something, and then the board, she said, I think she did it.
Yeah,
Or I
that's
think
me. That's
yeah,
Hannah.
yeah, that's not me. So
Yeah,
So
that's
who is the
Hannah
person?
Edafe.
yeah, so it
Anna
wasn't.
Adafe. Okay.
Yeah, that's
Okay, this
me.
Anna.
Yeah,
Okay.
so
I
somebody was
can
saying that
give her my phone number to call
she
me.
had a lot of information
Okay,
how
please,
to
can
go
you take
about.
it now? It's
Okay, let
Ada.
me send my number to the group. Is that okay?
That's fine, ma'am. Yeah.
Okay, yes, ma'am. I'll do that now.
Thank you.
Yes, ma'am.
I have a question, please, doctor.
Why, ma'am?
Oh, yeah, my question is this. If you already have your transcript from the school in Florida, is is that a problem, or I still need to call a board of nursing to get another one?
So
Because
what she's saying is that if your school already has a problem, there's a list of those schools that is struggling with Florida stuff and the Nightingale stuff. Now, if you need a transcript from that school, unless you are going to be with Florida, basically, but if you are going to be needing a transcript to be sent to another board of nursing on your behalf, they have already sent all the transcripts to FBI.
I
So
already
you
have
will,
my transcript from the school before. I had it with me. They already mailed it to me before
you
the
have it
school
with
was
you.
open. Yes,
That singular one, you can't be using it. That's your student copy.
they gave me 3 with a seal.
They give you 3. So most
Yes.
of the time, even if it is still like that,
Yeah, they will not let you.
that is it. They always want it to come from the school.
Okay.
Is the school closed? That your school that gave you the
Yes, they
transcript?
closed it. Yeah.
Okay. Call Florida
I
Board of
already have
Nursing
my
tomorrow.
ATT, everything.
You have already scaled through, so that's fine. You have already gotten your ATT before they go to the
Yeah, I
level
did. I already did my exam once. I did not pass.
Okay,
So I have
so
my,
if you have
and I
an
already
ATT,
paid.
so make it easy. Study,
Is
study,
she still
study.
with the Florida board, man? Are you still with the Florida board? Are you writing with Florida board?
Yeah, because the first time when they gave me, but I wrote it in DC here. I didn't go to Florida. So
Yeah,
the
that
second one, I pay Florida Board of Nursing, but I haven't paid the festival to mail it to me. But I already paid Board of Nursing, Florida Board of Nursing for the net because I'm trying to
Okay,
get my
pay
net.
for PSV because that's where the issue is. I paid for Texas board. Then I did not pay instantly for the PSV. So because I said, okay, let me get paid before I'll be able to pay that. So when I paid after like 2 weeks, then that's where this whole thing started. So the Texas board did not just reply me instantly. But I think your case is different because you are still with the Florida board though. Yeah, because Texas thing is crazy.
So I have a question. So the lady that she said she went to another school. So when you were in this Florida school after you finished, did you take the NCLEX on the Florida the first time?
Oh yes, I took it. I took with
Okay, so
Florida board.
that's
Yes. I took with
before you
Florida board.
switch before
Yes,
you
no,
switch over
yes, I
to
took with Florida board.
Mhm.
Then because it's just only TV tries, so I went to New York board. So it was in New York board that my eye got open that the school have problem. It was actually New York board that told me that the school have problem. I never knew. Probably I will still not know by now that the school is closed. So it was the New York board that put an hold on my account and said this school have problem and it's a serious case. So they don't even know when they're going to resolve it. I think that's when I have to run back to school because I never knew that the school had problem. Imagine you finishing school since 2019, 2021, they're still telling you they don't know when they're going to face problem. And you have 111 credit units from a decent community college. I don't even know what happened to me anyway. I know that's the devil's work for me to go to that route. All right.
Mhm. Yeah, it's gonna we'll just keep asking around. I'm sure it's gonna because I know someone that went to I think it was Killeen Institute and they closed it down and she went to a school in Dallas. It's called Gillen. Even me, when I heard about Florida the first time, I was confused. I even started with Gillen, and then they wanted me to do like a couple of math, another science. I was like, I already have a degree in all of that. Why am I doing that? So I didn't. So that's how I was like, okay, then let me just. And then our school didn't have the problem, so that's how I went back and took my exam. But she went to Killeen and she took the NCLEX one time, and then she went to Gillen and all her process went through. So sometimes it's just I don't even know what to say. It's just hard because it'll work for one person and then so maybe you should try another state. Try like one of these states where a lot of us and like Dr. Kemi always said, even me, I wish I knew somebody in Alaska and they were saying Guam. I don't know if anybody ever heard about that. They say some kind of island. And I guess Hawaii, those places where a lot of us are not there. So because Texas is hard, even me, I'm in Texas. Even though our school don't have problem, and I haven't seen anybody from our school that really had problem. They've been working and everything. But some people just because they see Florida, just the whole Florida thing, they don't even want to look at your applications. Even me, I'm like thinking about switching um my boards around, but I don't even know. So maybe if you have somebody in another state, try that. It might help. Um, and as long you can work, that's all that matters until everything is fixed. And it's based on different people because it worked for one person and then it don't work for another person, and then another person. Because a couple of people even went to Tarleton University. They took the NCLEX like 3 times other underneath Florida, and they went through Texas board, and everything worked out for them. So like it's just I don't know.
Okay, can I ask a
Can
question?
I
Because
can
I
I
went
can
to a
I
Florida school. I finished in 2020. I did the BSN, and I've done the board twice. I want to do it again, but I haven't applied yet this time around. I'm hoping. What I want to know is that did anybody have a problem with it applying? Like me for the third time because I haven't applied yet. I want to know if
if anybody has applied like that.
Can I have something to say?
Yeah, go ahead, please.
So my name is Caroline, and also I went to those Florida schools, and I registered for my board exam 2 times before the school started having issues. And then I decided to go back to school here in Minnesota, one of the community colleges. I just finished the other day, and I applied for board exam. In that, it has never given me any problem, and they gave me my ATT number.
Okay, that's fine. Everybody has, they have different stories.
Sorry, for the Florida, if your school is one of those FBI school, the board is gonna ask you to come face the panel. So when you face the panel, if you can prove to them like, okay, I already went to another school, even though they're not gonna take any paperwork from you, but if you can prove to them that you went to another school, they will clear you and then they will send you your ATT. However, if you cannot, if they didn't send you a letter to come to them because your name is in one of those FBI schools, you need to find a way to reach out to Florida board that you want to prove to them that, you know, you attended that school fine, but then you didn't build on it. You went to another school to start all over, and then they can take everything out.
Hello.
Well, the lady actually asked me though, the Florida board lady, she asked me if I receive a letter, like for the people that is going for panel or something like that. I said no, that I never received any letter because I think because I went back to school or probably because I did not pass the NCLEX yet. Because I think to my own understanding, the people they sent letter to come for panel in Florida are the people that already got a license to come and prove how they got that license. I think that's to my own
No,
understanding.
no, once you attend that, even once they have your name, like even if you went to make inquiries that, oh, I want to attend your school, and they have your information, the FBI takes all their electronics. Once they see your name in that school, they send you the letter, they put an hold on you and tell you to come face the panel. Until you face the panel and tell them, well, I went, but then when I heard they were having problem, I went to start all over from another school. And your school, you have your transcript, and you can, then they will clear you out.
Yeah, I never received any letter.
I never received a letter too.
These people, they just mess people up. What?
I know.
I don't know. You can go if you want to spend money. You can go on Florida website. It shows when they always have their BRN meeting. I think it's twice a month. If you want to go, because then you will have the big boss, the education, the director of education, Miss Jackson something. You will have them there, and you can talk to them. But everyone's case is different. If you didn't get a letter, I think that's what I would do before you start spending money for lawyer. So, and you
Okay.
already went to another school. You didn't build money. You didn't build on those
That's what I
FBs.
really understand.
So that's the only way you can get hold of them, like one-on-one. Other than that, they'll just be passing you around on the phone, emails. Even some of them don't know what to do. So
Yeah.
I don't
Okay.
Yeah,
know.
I tried
So
to
where is the
call them. I
website,
didn't
please?
get
Where is
response.
the website for me to check when the next meeting?
His Florida website, and then you just check meeting, I believe. Then it's gonna show you when next they're going to have the meeting, and you can see the previous one too. But you just have to be on top of the game. If you say, okay, let's say they want to have one on Monday, you have to be on top of the game to be sure, because sometimes they cancel. You have to be sure so that you not be like you book hotel or something, or maybe hurricane or whatever. You just have to be sure it's gonna hold when you want to go, to just confirm.
Okay,
So,
I think the best thing is to call the Florida board to ask to tell them that yes, I want to come for the panel too. So they can give me a date. I believe so.
Yeah, I guess this
But,
information is better instead of you
but
getting a lawyer.
I don't think you have to call them because definitely they send the letter. If they send a letter to you, then you have to respond whether you want to go or not. But my question is that, what about if you accept to go and you later decide you don't want to go? So do anybody have idea what will be the consequence?
Okay, that's another good question.
I don't understand.
If they
Like
give
if
you a
they
letter,
sent you a letter and you already replied them that you want to come to the panel, and maybe later you decide, no, I don't want to go, then do anybody have idea what would be the consequence if you, because already in that letter they already said if you reject it, they still give you like 30 days. So what about if you don't want to go at all?
Hello.
You don't want to
Good
go.
evening.
It's like no show. Like they will. It's like you forfeit. Like you just. So you have to tell them because they give you two options. Say you want to
Hello.
come.
Yeah.
Hello.
Yeah,
Hello.
I'm here.
Good evening. Good evening.
Go ahead,
Um,
please.
I actually went to something like that. When you, what you're gonna do is that try to go over there. When you get there, they're gonna tell you if you want to withdraw, come out. So
Okay.
your name is not gonna be tagged. So when you just come out amicably, tell them you want to withdraw. That's it.
Okay.
So you're not gonna have any problem with them anymore.
Okay.
Yeah. So I
Okay.
would just advise you to go over there on that day they ask you to go. So when you get there, just withdraw.
Okay.
So you're not gonna have any problem.
Okay. Thank you.
You're welcome.
already. So the person that asked the question of Naomi, so who is going to help us? Who is going to help the person? So please, that person, Miss Evelyn, you are the one that asked that question, please.
Yeah.
Okay.
Never.
So she's going to start. Somebody's going to start telling you now. Never.
Never.
Okay.
None.
None.
All. Always. Often.
Mm-hmm.
Only.
Mm-hmm.
Most. Many.
Mm-hmm.
Every.
Okay, thank you.
You're welcome.
Hello, Nurse. Dr. Ken.
Go ahead, ma.
Hello, ma.
We can hear
Yes,
you, ma.
ma. Good day, everybody. Please, I need somebody to help me for registration in Ohio Board of Nursing. Please. I don't know if anybody have registered in Ohio.
Do we have anyone that has made the registration with Ohio?
You can
Just to
call me after. You can call me after the meeting.
Can I get your number, ma?
Can you give her your number?
Yes, 919-457-8738.
Hey, doctor.
Okay.
Dr. Kenny.
Go ahead, ma.
Yeah, please, I want to know, like we got to a place, you said APN don't eat biscuits. What's the meaning of that? I think I missed that
Please,
side.
can I get the number again? Please.
Can you repeat the number
Please,
again
number.
for?
Yes, thank you, ma.
919-457-8738.
919-457-8738.
Yes,
What's your
ma'am.
name, please?
What's the name?
Bukola.
Oh, thank you so much. I'll call you. Thank you.
Excuse me.
Thank you.
Excuse me, Dr. Kemi. I have
Dr. Imagine.
Yeah, we were saying somebody wanted to ask, was asking about eat biscuit.
Yeah,
So let
that
let
APN don't eat biscuits when it comes to paralysis. Yeah.
Okay, so who is going to tell us LPN don't eat biscuit? What will LPN not do?
Educate,
They don't educate, okay?
assess,
Assess, okay?
teach,
They don't
Okay.
teach, okay?
blood,
Blood, okay?
IV, and
IV,
central line.
and central
Central
line.
line.
And that is it. LPN don't eat biscuit.
Thank you, ma'am.
sorry, excuse me,
Go
doctor.
ahead, ma. Go ahead, ma.
Yeah, I know you were saying something. You didn't go into details because I think you yourself said you don't know much about that. Can one apply to two board of nursing at the same time?
Yes. You can apply 2 board of nursing at the same time, but you cannot have 2 ATTs.
Okay, so my question is, you just have to pay the both application, and you pay Pearson View for that other board and pay Pearson View for that other board. That's just my
You can
question.
only have one Pearson, or you can have 2 board application. You can only have 1 Pearson.
Okay.
So what I'm trying to say right now is that peradventure you apply with Florida nursing, and the time is they are not really responding as the way you are expected, and you start with Texas Board of Nursing. Their own is faster, and they give you authorization to text earlier. Then you can pay for Pearson. So when you pay for Pearson, Texas does not know you have application with Florida.
Okay.
They don't know. So that is that. So peradventure, if you now apply, you have an authorization to test right now with the 2 board. You now call Pearson. So at that point, Pearson will tell you which one do you want to test with, because the 2 of them are giving you authorization to test. So you can now decide which one to. So you can have many applications on file. Like if you start with Texas, like Texas right now, they are asking for anything whatsoever from anyone now. They are bossing up their game. The moment they see that you are Florida, I don't know what is, even when your school is not closed, they want to have necessary things. You start wondering, what is the big deal about this endorsement? So it's too much. It's too much with Texas.
Wow, Dr. Kim, I never knew that you can apply multiple states, even if you already applied to. Oh, I never knew.
It's your money. You can apply with any state whatsoever.
I think
you can only have one Pearson application.
Okay, Dr. Kemi, since I went to school in Texas there, so if I'm going to a different state now to apply, so is it going to be like single state or multi-state?
You now decide, because if you don't have an address there, it's going to be a single state. The moment you don't have an address, maybe you are living in Texas and you want to apply with Georgia Board of Nursing. You don't have any address in Georgia. You just have to declare that I live in Texas. So if you declare that you are living in Texas, it's not compulsory you use the only reason why people are looking for an address in that new board is because they want to do compact from the word go, make it a compact state. And you won't have to come and be doing an endorsement immediately after you pass. So that's why people always want to have a address of the particular board they're applying with. But if you don't have the address, you don't have to stress. Many people are in Africa. They are doing the exam and they are not in the United States. And they're applying with board. They are using their Nigerian address because they will just give them a single state. So once they travel in, they will now come and endorse, or they don't even have to travel in. The moment they pass it, they'll just do an endorsement. So that's it.
Okay, thank you, ma'am.
Okay. So, Dr. Kemi, so if I do, if I have address with other, let's say maybe family or friends or another state, I use their address, right? So that means it's going to be, that means I will apply on like in multi-state, right?
That will be multi-state, yeah.
Okay. And if I get my license, I don't need to do endorsement immediately. I can be choosing to work.
To work, depending on if that state is compacting. It is not every state that is compacting. Some states compacting, some are not do compacting. Some 35 states come together, they say they are compact. If you have one, you don't have to be doing endorsement. You understand? But if you have to go to another state that is not compact with those states, you will have to go and endorse.
Okay, so yeah, how do I get the information for the compact state? Anybody have it, please?
Just go to online and just say which state of which board of nursing are compact. It will pull it up as we are talking, and you will see those
just
ones.
Google it. Just Google it.
Oh, okay, okay.
All those information are everywhere. They didn't hide it.
Okay.
But first thing is to give all your energy to pass that exam. The moment you pass, every other thing will fall into place.
Yeah.
Every other thing will fall into place. All the people that passed this past 2-3 weeks, they said they were not having papers. We just connected them with those agencies. All of them are calling and saying, Dr. Kemi, thank you. They have given me pay. They have given me job. Or they only said I'm going to be flying to this state. I said, which one do you want? Do you want to stay in this Texas that they say, oh, everybody wants to live in Texas? Or you just want to fly there and go and work for them for 2 years and get your green card? Which one do you want? So that's it. So it's all about information. Who are you talking to? Who are your friends? Disconnect from friends that will pull you down. If they are not moving, you don't have to connect with them. They will pull you down. Be careful, especially the moment when you are getting towards being a nurse. The moment you get to become a registered and helping, elevation brings automatic separation. It is not you that is proud. You are not proud. The moment God has placed you in a place, don't come and put yourself down again.
Yes.
You are going to be selective of the people you relate with. It is not pride. That's the level you are now. Every chapter, once you close chapter one has already closed. Don't go back there. You are now in chapter 2.
Hey, doctor.
Don't go back there. You are in chapter 2. Let them be shouting, oh, come back to chapter 1. Are you kidding me? You want me to regress? I'm not regressing. If you want to join us, join the moving train. Let us all move together. I like that. Most of us are doing well. You will not stress me out. And that's why I'm always ready to help anybody that come around me. Why? In a way, I'm helping myself. Those ones that passed that we connected, they started working now. They would not come and say, Dr. Kemi, come and give me $100. Why? Because she's making money. So if all of us are doing well, nobody will be against anybody. We are not going to be jealous of each other. We will not talk about ourselves in a negative way. There will be peace in this world.
I have applesauce.
Be happy.
Dr.
Can
Kemi,
I please call you after the class?
I just wanted to add to that lady that's having problem. Another thing you could do, I know like some of my colleagues, my schoolmate, when we finished school, they were in California. What they did is they wrote the board of, because California, for some reason, when that whole thing started, they were just holding anybody from Florida license on hold. So what they did, they wrote the board of nursing California board, and they wanted to meet with the director, like the overhead bus. So maybe you should do that too, also Texas, because Florida, if you don't have anything to do with that school, and then when they met with the director, and they asked the director why was they putting hold on their license, and then they said because they went to Florida, but their school, and then they said our school don't have any problems. So the board of directors, I think there were three of them, they said they look at everything, and then they said that if you guys are accepting international students, and without no, you're not vetting them like the way you're vetting us from Florida. And we actually went to school in the state. So if you're accepting people from India, Africa, and everywhere, why is it? And they said right there they give them the license. So maybe you need to make do an appointment with the Texas board, the board of director, and said that you've tried to reach to everyone in Texas. You went to school in Texas, you would like to speak with the overhead boss. Make an appointment. And say that I went to school. Yes, I went to school in Florida. I'm not associated with Florida. Florida has nothing on my thing, and I went to a new school. So I don't understand why you guys are holding my license. If you're accepting people, international people from anywhere, without even vetting them. So that's what a lot of people did, and they got their license. So maybe it's something that you can do, because it's, if Florida is not giving you that information and you already went to a school in Texas, maybe you should write the board's director, not just the overhead boss, and say, I want to speak to the overhead boss. I've been calling. I've called here every day. Nobody have ever answered me. Everybody I've called, they send me different places. Is there a way? And they'll make that appointment, and you can speak to the director. And they say most time, if you speak to the actual director, you get either they accept you or they don't. So that's another thing you could do. Just wanted to
That's a
add.
confident. I like that. It's still part of what I just said. If you have that confidence to say, can I talk with your boss? You just have this mentality. I deal with bosses.
Oh yes, I have the confidence because I went to a good school, not just any school.
So let's try that, Miss Ada. So you can just say that, because you went to after they said the Florida was having problems. You took a bold step to go back to another school.
And you did everything.
Why they are still stressing you to go and bring a transcript of the whole school is still confusing.
So you would like to speak to the director, the overhead boss, because everybody you say I've spoken to everybody. They keep turning me around. I've called here every day, so I need to, and you send and not only call but send a written email, and then whoever you speak to ask for the ID number. Take everything so that way when you're calling and you're talking to them, you be like, I spoke to so and so. This is the ID number. Then they know what you're talking about. And you tell them, I went to school here. If you guys are accepting people from India's different country, I went to a school in America. And even if it's even in Florida, and if that school don't have a problem, they're not on the list. People got that's what people are doing because there should be no reason. But sometimes they'll pass you around, and sometimes they don't even know the answer. Most people that work too, and I just starting to understand most of these places are using different countries to answer their phone calls.
Yes.
They don't want
Wow.
to pay here. They don't want to pay people that work here. So they use like
Yeah.
the Philippine, the even
Some of
piercing
them are not
Even
even they are not even
piercing.
in the
not
United
here.
they are
They
not
are
even in the
agents.
United
They're not
States.
here. So they don't even have the information.
Patient,
That's
yeah.
true.
So that's what you want to do. You
Some of
call
But
them
the
you
they are
thing,
not even here.
Mhm.
the thing with that is that she has
That's
to do it
completely
in two
true.
places. She has to do it with Florida and then to
Yeah.
Texas.
So
Because
Texas.
that
Texas would tell you, well, it's not my problem. Florida put an hold. You need to clear yourself with Florida first before then you do this. If clear before you go to Texas. So it has to be two places that you have to man up and be like,
yeah,
well,
because she said she already went through that with Florida, and Florida is not saying anything. So I think that's what I would do. You tell them.
Oh my God,
yeah,
who's that?
because
21?
Texas would be like, because I had
Are
the
you
same
telling
problem
me they
with
had three?
Florida still, we didn't get anything from Florida, so they'll be passing you around. You just have to put
So
your
you
foot
tell
down.
them I want to speak to the director. I've already even the FBI, they're not giving anything. Because I didn't continue with the school. So do that, send an email to the board's director. And
I'm
sometimes if
changing all the question now. Go ahead. You can do your talk.
yeah, if you look on the board, you will see sometimes you'll see their director name there, and you can email that person direct. If you can't find it there, they'll give you the name. So
Okay.
you
Because the
can
message, the message they sent to me when I put in the application, they only put in the Board of Nursing email, their phone number, and their address. So there's no, I don't think they have their director's information
Go
there.
on their website, you'll see
it's
all the
there.
names.
It's there. They will tell you if they can't. They're supposed to. There's no reason why they should be hiding it. It's there. There is the overhead boss. That's who I'm talking about.
You see it on their website.
So when I call,
Yeah,
I'll say, can I speak with the director?
when you call or when you email, say, I've been calling, I went to Florida Board of Nursing, I've been Florida Board of Nursing, I've even spoken to the director of Florida Board of Nursing, and they told me I have to, because since I did not continue with Florida and I went to a school in Texas, there is nothing that they can do. So I have to deal with Texas. So those are the information. So, and everybody I've spoken to in on online or through email, they haven't been able to give me anything. That's why I needed to reach you, the director, because I went to school in Texas. I started everything all over. So is there a way? Because there has to be a way. They can't just be sending you all over the place. You went to school here. This is where you got your degree. And if you did your prereqs here, it's what you're gonna build on. So there should be no reason. And I don't know, like I said, everybody is different because I know a couple of people who went to Tarleton University, they went to Killeen, and they already have their ATT, they already took their NCLEX, they're working. So and God, sometimes when good things is coming for you, it's hard. We can't say it, but prayer, like Dr. Kemi said, when good thing is coming for you, it's not gonna be easy. Because
Yeah.
once you're done with that, everything is you're gonna be
Yeah.
elevated to a next level. So just
Yeah.
take it like that, but you just have to, you can't sit, because it's not going to come from heaven and just drop on you. You just have to keep trying, try any kind of way and do whatever. So speaking to the board of director will be, their overhead boss will be like something that you can do.
I went to Kaylin and I got my ATT twice, even during all the issues, even though I didn't pass my board. But I want to apply again.
And what year did you go? Because some people,
I
like I said,
finished in 2020.
See, so that's even better. The ones that I know, I think when they finished, it was right around the whole Florida thing, and they went to the other
When
lady. She
was
went
the Florida thing? Because I don't even know.
Florida. I think it started 2023 December, right? 23
Oh,
22 December. That's when everything came
Yeah.
about. 2022 December, around that time.
okay. So
So
what year are the FBI having issues with? Because I don't know
um,
anything about this thing.
I have no idea, my dear. They just have like if you go to each board of nursing, they have like the list of the schools that
Yeah.
they
Dr.
said
Kemi,
they're
the thing, we didn't know that you have started.
I've started. I've already said it.
I didn't hear.
so I
I'm
Started
don't
so
what?
know
sorry.
exactly what year, but I know the news on the news it was somewhere around December of 2022.
Okay.
So
Because during that issue,
if
I
you're not
I
having
did my
that
ACT
problem,
twice.
if you're not having that problem, there is no reason to even start questioning about that.
Yes, and I
2020.
felt I heard that it was about the associate degree and the LPN degree. It wasn't about any other degree. So I don't know. Maybe that's true.
Thing is, it's just based on your school and when you went or what they're doing. I don't know. Like I said, everybody, God works his way. Everybody, some people, everything is working out. They've been changing their license, they're fine, and who knows. But
Yeah.
that's what I would tell her. Reach out to the board of director. That probably might help you. Because if they're allowing people from international and everywhere without even vetting them and people who actually went to school in here just because of whatever, and they're so those are the things you can say.
Yeah.
Thank you for that.
And I just want to say something. I think it's also people that moved um their schools, or it's not their school, their
I went to apply
OTC
with
to
another
other
board.
states. Yes, I think most of them are having problems.
If you are from Florida and you know that your school is part of that school, just stay in Florida.
Yeah,
Don't
I
go
think
to
that's
another
the
board
best thing.
so that's always where all the problem is coming from. But she has the confidence to go to another board because she already went to
Yeah,
another
she
school.
already went to another school, so I don't understand
So
why they're giving her any issues at all.
that's Texas for you.
Think the reason is because our school is on that FBI list.
Yes,
So
but she went to another school
they
entirely.
need to
It shouldn't
clear her
even
first.
affect it.
Yeah, they need to clear her first because anywhere she goes to is gonna keep popping up. They
Hmm.
need to either Florida clears her or FBI. They just gonna keep popping up like that.
And they didn't write her any letter because they said it's some people that they wrote letters to. So, I mean, how do they know who is on the list?
They have the list. They have the name of all the schools. They go through their computer, and if they see your name, you are not there to defend yourself. Boom,
Yeah.
old, even if you did not attend the school.
But I
So
think the best thing for me is
letting
not
you.
to go to Florida to clear my name. I'll search for when the next meeting is going to be. So I'll go there, even if I don't have anything to do with them. I will just go there to see if they will remove my name from the nonsense from their
Yeah.
system. So
Yeah.
Yeah.
then before I contact the director of Texas board, yeah.
Yeah.
Yeah,
First
because
of all,
that's
clear
the only
yourself
way you
from
can.
Florida.
Yeah,
Yeah.
because that's the only way you can see a physical person. So they might schedule you, or they will attend to you. If you keep calling or sending email, most of them don't know what to do. They keep passing you around. So if you can spend the money to go, you see all their directors there, then you can, table your problem to them, and you can move from there. Because
Uh,
once they clear you, they will be the ones sending letter to Texas and to tell them like, oh, this is, they'll fix it. But it has to start with Florida.
Okay, do you think I should go with all my transcript from the community college and the university that I
Yes,
went
take
with?
everything with you.
Okay.
Everything.
It doesn't hurt
Yeah.
to take everything. If you don't
Even though
need
they
it, you
will
don't
take
need
it
it.
from you, but you tell them you have everything, because that's the first thing they will ask you. They would ask you, okay, did you go to another school? Yes. From which year to which year? You tell them, okay, and that's it.
Show us evidence.
And then you have your proof, even though they will not take any paperwork. You tell them you have everything here. That's it. You even be surprised, like, this is it, and you guys have been holding me up, but you even be happy. Not you will not you'll be too happy to be asking further questions.
I guess the FBI should be there on that day.
The
And make sure,
FBI, they might be there. We don't know. Probably, they will not dress like they are FBI, but they have
and
all
make
the
sure you
board
take your
and
clinical hours.
security.
Make sure you take your clinical hours.
Yeah,
Clinical
that
hours
one
from
too.
Yeah,
Mm-hmm.
that's the very important one. Yeah.
clinical hours from the school that I went to.
The
Yes.
new one.
The
The
new.
new one,
Where will
like,
Yeah.
will the school have it? Because I don't have any information
Yeah, the
from.
school have it.
Yeah,
Oh,
just
okay.
request for
Your
your
transcript.
transcript.
It
Yes,
should be on
and
your
then
transcript, right?
yeah, don't open it, close it. Like the same way they give it to you, just go give it
Okay.
to them. Let them open it. You don't open it.
Okay.
Yeah.
All right. Thank you so much.
and just know the hours that you did too. The clinical hours you did in your new school, everything you did everything about your clinicals, everything about your nursing program, because they will be asking
I
you.
think it should be in the transcript, right? Everything should be in the transcript.
It will be there, but you can't be looking at transcript. They will be asking you and looking into your eyes like this, like you're going for a visa interview. You'll be telling them, you did your clinical, the hours, the place you
That's
did
true.
your
That's true.
the situation. They'll be asking you about, they don't want normal situation, it's abnormal situation. They can ask you like, okay, on Pete, how do you treat a patient with a 3-year-old with asthma? You'll be telling them, and you let them know that you are working in healthcare, things like that. So, but be confident and pray.
But they should be crazy for them to be asking me those questions for pediatric when I've never worked.
Because they want to know. Everybody case is different. They want to know if you really did the clinical. If we let you go, can you be a good nurse? That's what they trying to find out.
With the
So
stress they are
you be
giving to me, I've
prepared.
already forgot everything. Anyway,
Yes,
I'll work towards it.
you
No, but
read before you go.
you're doing NCLEX review now.
Just
So
like you want to go and do another NCLEX.
Yep.
you're doing NCLEX
Mm-hmm.
review. So
I
just
said.
so just use that. These people are
And your demember matters too, because I think it's
Yep.
only when I went, it was only a black woman. I think she's from the Caribbean. She's the director of education, and the rest of them are white. They'll be looking straight in your eyes like this. So
Yeah.
you pray, you tell God to keep you calm. If you can hold your finger together on the table and just calm down and answer the question one, because they want to, it's like when you go for visa, I don't know, just calm yourself down and just take a deep breath. So,
It's really a panel.
You pray into the atmosphere. You pray into the atmosphere, yes. And let
Alrighty.
God take control.
Okay. Thank you all for coming. See you tomorrow.
Thank you so much,
Thank
Dr.
you,
Kelly.
doctor.
Alrighty.
thank you, doctor.
Thank you, doctor.